Sandy, you're ready to go.
Great, thank you. Welcome everyone, and thank you for joining us today. My name is Dr. Sandy Chung, and I'm a pediatrician and medical director of the Virginia Mental Health Access Program, or VMAP. We're so excited to have reached this moment and acknowledge the hard work that so many have put into making this possible. In the spirit of Mental Health Awareness Month, we're excited to announce the official launch of VMAP, our statewide program, which will help children and families in Virginia get faster access to mental health care. Over 1 in 5 children have a diagnosable mental health condition, with over 75% presenting before the age of 24. With VMAP, we can actually screen, diagnose, and treat children and adolescents sooner, trying to prevent the more serious outcomes of hospitalizations, ER visits, substance use, and even more seriously, harm to themselves or to others. With the pandemic, we've seen an increase in mental health conditions across our country. Pediatricians every day are seeing more and more children with anxiety, depression, and other behavioral disorders. During the pandemic, we surveyed our Virginia pediatricians, and when we did that, 88% of them reported seeing more children with behavioral and mental health conditions. We need to do something soon to help. Even in just the last week, I heard about a child, a 10-year-old, who was suicidal. I talked to another pediatrician about teen athletes who are severely depressed. I talked to an ER director who said his emergency room was filled with children and adolescents waiting for psychiatric hospital beds. It's urgent that we address this mental health crisis, and we must provide equitable and accessible care for all children in Virginia. VMAP helps to do this. By training our primary care providers to do this work, we're able to get all children and families access to mental health care sooner. We're so happy today to announce VMAP is now statewide. I'd like to take this moment to introduce our Secretary of Health and Human Resources, Dr. Daniel Carey. He's been incredibly supportive of VMAP, and we're so grateful for his support. Secretary Carey.
Well, Dr. Chung, thank you so very much for that warm introduction and for your leadership of this process from the very beginning. Really excited about going statewide today. And again, thank you to the MSV Foundation for inviting me to join in the VMAP organization. As Secretary of Health and Human Resources and a former MSV president, and as well as MSV Foundation president, I know firsthand the incredible work and advocacy that the MSV family of organizations has done as part of this, in addition with all the other partners in the VMAP process. The Virginia Mental Health Access Program is a statewide initiative that helps healthcare providers take better care of children and adolescents with mental health conditions through providing education and increasing access to child psychiatrists, psychologists, social workers, and care navigators. Based on data this year from the National Institutes of Mental Health, we know that suicide is the second leading cause of death for children and young adults ages 10 to 24. The COVID-19 pandemic has taken a toll on our physical health as well as the mental health of Virginia's children's, young adults, and families. Increased need for mental health professionals paired with a decreasing workforce has left many Virginians without access to these crucially needed resources. Even with such a challenging year, we'll have more challenges ahead, and we are ready to face those head on. I've got some more numbers to share with you. The Virginia Department of Health reports that 64% of Virginia localities are mental health professional shortage areas, and only 2 counties in Virginia have a sufficient number of child psychiatrists. Here in Virginia, there are only 13 child and adolescent psychiatrists available for every 100,000 children below the age of 18. Yet 90,000 children, or 14.28% of children in Virginia, have had at least one major depressive episode. Of those 90,000 children, less than half received mental health treatment, and even less received consistent treatment throughout their condition. These are intimidating numbers, but the Northern administration has always been solution focused. In 2018, the Virginia Department of Health received a grant that started primary care pediatric mental health training programs in a part-time child and adolescent psychiatrist consult line. General Assembly funding in 2019 allowed us to implement hubs in the North and East regions of the state with full regional services for PCPs, including increasing the consult line access to full-time, full 40 hours per week, increasing the number of behavioral health providers on call, providing more educational and training opportunities, and the creation of a care navigation set of services. VMAP recently partnered with Unite Virginia to support efforts in building their Unite Us platform, a coordinated care network of health and social care providers. VMAP will work with Unite Virginia to enhance the platform's current network to include behavioral health resources and supports. Since August 2019, VMAP has seen tremendous growth in the use of services. And as of April of this year, approximately 505 providers have registered to receive VMAP services statewide. 451 providers have participated in our various educational and training opportunities. The program recently hit a major milestone of providing 1,000 consults from August 2019 through April of 2021 across the state. As VMAP expands, we also take this time to have a purposeful focus on health equity to ensure providers and ultimately children and families can benefit from this valuable service. VMAP has developed equity statements focused on youth of color and underserved populations, which express our intent to provide a framework for our work going forward. The recent formation of the VMAP Equity Advisory Committee is a tangible way we have begun to build on these statements. This group will provide guidance and recommendations to help ensure an equity lens is applied to all our work. Thank you, VMAP, for all you're doing to increase access to mental health services for Virginia's children. So while we've come a long way, we've still got a ways to go. I look forward to working together to make Virginia a healthier, safer, and more equitable state for all Virginians to live, work, and play in. It's now my honor to introduce my boss, the 73rd Governor of Virginia, Ralph Northam, who will share a special message.
Hello, I'm Governor Ralph Northam, and I'm so happy to be part of this event celebrating the official launch of the Virginia Mental Health Access Program. As a pediatrician, I am highly aware of the many ways that mental health impacts kids and families, and I am deeply grateful for the work that VMAP does to expand access to mental health assessment, diagnosis, and treatment for children and adolescents. During Mental Health Awareness Month, it is important that we acknowledge the prevalence of mental health disorders in children and adolescents in our country, and more specifically, in our Commonwealth. According to a 2019 Virginia Youth Survey, 1 in 4 middle and high school girls and 1 in 8 middle and high school boys seriously contemplated suicide in the last 12 months. And the COVID-19 pandemic has only created more challenges, burdens, and stressors for Virginia families, resulting in increased rates of anxiety and depression among our children, youth, and their caregivers. Recent data points to an increased need for pediatric and adolescent mental health treatment and services and not enough provider capacity, making efforts to expand the workforce all the more critical. Prior to the COVID-19 pandemic, less than 10% of primary care physicians surveyed across the Commonwealth said there was adequate access to child mental health services. and 65% of pediatricians surveyed nationally reported they lacked mental and behavioral health knowledge and skills. VMAP is a key part of the solution, serving as a vital resource for children, families, and primary care physicians across our Commonwealth. As I always say, there is power in every child, and having access to mental health services with a provider they trust is a fundamental part of helping them grow and thrive. That's why I am so proud of the work this program does and grateful for the people who support it every day. VMAP has achieved tremendous growth in just the past year, and I look forward to working with all of you to build on its success in the days to come. Thank you so much.
Thank you, Governor Northam. We are now pleased to introduce the Department of Behavioral Health and Developmental Services Commissioner Land. Thank you for joining us.
Thank you so much for having me here. About 1 year before the U.S. was dealing with our first COVID-19 case, a study came out from the University of Michigan saying that nearly 1 in 7 children and teenagers nationwide was struggling with a mental health condition, but only half of them were going untreated. Stigma, a lack of insurance coverage, and a workforce shortage are all reasons for this. And over the past year, we've seen the pandemic exacerbate these existing mental health conditions for many and to reveal new mental health concerns for others. In fact, Mental Health of America reported that roughly 9 in 10 people under the age of 25 have screened with moderate to severe depression during the height of COVID-19, and 8 in 10 screened with moderate to severe anxiety. It goes without saying that we expect the behavioral health impacts of COVID-19 to last far beyond when the pandemic is declared over. I simply can't think of a better time for VMAP to be launching into high gear. DBHDS believes the integration of behavioral health services into primary care settings is an essential step forward to reducing stigma and increasing access to critical mental health services. So last year, when DBHDS selected the MSV Foundation to be the administrator of VMAP, we saw the potential to advance this goal and to grow and sustain VMAP on the state and regional level. The pandemic has slowed but not stalled our efforts. Over the past year, we've seen pediatric and psychiatric partnerships develop that will ultimately expand access to early screening and management of behavioral health needs for children across our Commonwealth. With this program, we'll be better able to serve children and adolescents in their communities with their trusted physician providers to more quickly identify emerging concerns and ensure linkages to resources and to services. VMAP capitalizes on the opportunity to intervene during youth, which increases our chances to improve well-being and redirect previous childhood adversities. Let's keep working together to set the stage for abundant adult lives for all children with mental health conditions, not just half of them. Thank you so much.
Great. Thank you so much, Commissioner Land, Governor Northam, Secretary Carey, for your inspiring words and for the overview of why we need a program like VMAP. I wanted to spend just a few moments here to describe exactly what VMAP is and how it works. To start with, though, I did want to share this graph with you, this map of Virginia, and Secretary Carey referred to this briefly. If you look at this map of Virginia, this is from the National Academy of Child and Adolescent Psychiatrists, their webpage. And what you can see here is the counties that are in green have enough child psychiatrists for the number of children in that county. The yellow counties, there's a shortage of child and adolescent psychiatrists. The red counties, there's a severe shortage. However, the gray counties have no child psychiatrists at all. Virginia actually ranks 41st lowest in the country for the number of child and adolescent psychiatrists for the number of children in our state. So VMAP is a solution to this, one of many. What is it? There's 4 parts to it. The first is education. So teaching pediatricians, family medicine doctors, nurse practitioners, and physician assistants how to better manage conditions like anxiety, depression, ADHD, bipolar disease, autism, so many different complex diseases that we know our children and families are suffering from in our Commonwealth. Once we teach the primary care providers how to screen, diagnose, and treat these conditions, they often will need, or not often, but sometimes they need assistance from a specialist, a child and adolescent psychiatrist. And on that previous map, you can see there aren't enough for every patient to go and see themselves. So instead, in this model, the pediatrician, family medicine physician, nurse practitioner, and PA can reach out and talk to the child psychiatrist to get assistance. And that's what the child and adolescent consult line is for, the adolescent psychiatrist consult line is for. Today, when I need to ask someone a question about, for example, a child that might have a heart condition, I can call and speak to a cardiologist today. And they can pick up the phone and they'll talk to me, and sometimes they'll even see the patient right away. That doesn't happen in child and adolescent psychiatry because of that workforce shortage. So instead of that, we now have a statewide phone line where instead a provider can call and speak to someone within 30 minutes. Care navigation is a third pillar of VMAP. And in this instance, we're actually working with the family directly. So a pediatrician, family practice physician, nurse practitioner, PA will call VMAP and say, I have a child who has a certain condition, for example, and they need a therapist in their community. And our care navigators will reach out to that family and help them find care in their local community. The fourth arm of VMAP is telepsychiatry or telepsychology. This is still under development, but it is something that we know is going to be the future. Through the pandemic, we've seen so many uses of telemedicine. Mental health conditions lend themselves very well to using telemedicine. And so having VMAP have that as a service can be very helpful. Here's another way of looking at how VMAP works. So on the left, you can see the primary care provider gets the education. And then if they need services from the consult line, they place a phone call. It goes to a call center in Richmond. And then the call is triaged either to the child psychiatrist. We also have licensed mental health providers who are available for consults. Or if they need care navigation services, they're directed that way. And should a telepsychiatry or telepsychology visit be necessary in the future, that can be offered. And as was mentioned, we've been off and running, and we're so excited now to be statewide. But thus far, we've already have 505 providers registered. We've done over 1,000 consults today by now, and then 451 providers have been formally trained. We serve a wide population across the state, and we're excited to say that it's a fairly diverse population. We are continuing, however, to increase that so that we have equitable access across our Commonwealth. 29% of the youth who have received support thus far are enrolled in Medicaid, and 34% have been identified as youth of color. So those are some high-level views of VMAP and what's offered, and we're so thankful that you all could join us today, and we would love to have your questions if you have any, and wanted to open the floor for that. I believe now you are being elevated or promoted so that if you have a question, feel free to unmute or put a question in the chat or the question and answer. I think this means we did a good job. I don't see any questions.
Dr. Chung, we understand that our media contacts just hopped off, so I wanted to thank you all. We are going to set up a separate interview with you directly preceding this. We'll be receiving a Zoom link shortly. Thank you, Commissioner Land, Secretary Carey, and Dr. Chung for being here today. Governor Northam as well, and appreciate you all celebrating the launch of VMAP and officially moving statewide as a program, and hopefully helping to meet a lot of this need that you all talked about. So thank you everyone for attending today, and have a great rest of your day.
Thanks so much. Thanks for allowing us to participate, and congratulations. This is so very, very important. Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.